Hi everyone, in today's video we are going to discuss acute kidney injury and we're going to go over what happens in each phase. Please be sure to subscribe and turn on notifications so you never miss a video. Now let's jump right in. Alright, let's start with the first phase of acute kidney injury, which is the onset phase. The onset phase can last anywhere from hours to days. Several factors could trigger the injury, such as blood loss, burns, fluid loss, or conditions such as diabetes insipidus. What happens here is that the renal blood flow drops to only 25% of what is normal, meaning that the kidneys aren't getting enough blood to function properly. In addition to renal blood flow decreasing, oxygenation to the kidneys decreases as well to only 25% of normal, leaving the kidneys struggling to do their job. During the onset phase, urine output falls below 0.5 milliliters per kilogram per hour. I mean, think about it. The kidneys are responsible for filtering blood and turning it into urine. But if blood isn't adequately flowing to the kidneys, they won't have enough blood to filter into urine. As a result, less urine is made. Now let's talk about the Oliguric phase of acute kidney injury, which typically occurs within 7 days of the onset phase. This phase can last anywhere from 8 days to 2 weeks, or even longer in some cases. During this time, there is a dramatic decrease in urine output. Urine output drops below 400 milliliters per day. In a 24-hour span, this is probably less than about 16 milliliters of urine per hour. As the kidneys struggle to filter waste, we do see an increase in BUN and creatinine levels, which both let us know that the kidneys are not functioning properly. Some other symptoms that may accompany this phase are electrolyte imbalances, fluid retention, as well as metabolic acidosis, because remember, the kidneys can't excrete waste or excess fluid as they normally would. Okay, so guys, this is very important. One of the big issues during this phase is hyperkalemia, which is a high level of potassium in the blood. Now, normally the kidneys would filter out excess potassium, but since the kidneys are not functioning properly, potassium builds up, which can negatively affect heart function. If potassium levels get too high, it can lead to life-threatening arrhythmias or even cardiac arrest. Because of this, the patient should be placed on a cardiac monitor to monitor heart activity. Another problem is hyponatremia or low sodium levels. This happens because, again, the kidneys cannot get rid of extra fluid, causing the body to retain water, which dilutes the sodium in the bloodstream. Fatigue and malaise are also common symptoms during this phase, which is expected because the body is under a lot of stress during this time. Now let's move on to the diuretic phase of acute kidney injury. This phase has a 7 to 14 day duration. This phase begins once the underlying cause of AKI has been corrected. During the diuretic phase, the kidneys start to recover and urine output begins to increase. The patient in the diuretic phase can excrete up to 4 to 5 liters of urine a day because the kidneys are excreting all of the retained fluid from the onset and Aliguric phases. This is why this phase is called the diuretic phase, because the patient is frequently diuresing. Though the patient is finally diuresing, there are still some issues with kidney function. Renal tubule scarring and edema may occur. Also, as the kidneys start excreting excess fluid, we often see electrolyte imbalances. This can lead to conditions such as hypovolemia, dehydration, and hypotension. BUN and creatinine levels, which were previously elevated, will gradually normalize during the diuretic phase, signaling that kidney function will soon return to normal. Now, your patient is finally in the recovery phase. The recovery phase can last anywhere from several months up to a year. This phase begins when the glomerular filtration rate starts to increase. As the kidneys begin to recover, you'll notice that edema decreases and fluid and electrolyte levels balance out. During this phase, the GFR may return to about 70 to 80% of its normal function. BUN and creatinine levels may drop as kidney function improves, giving us the signal that the kidneys are effectively filtering waste again. Now, although the kidneys may still be recovering during this phase, we do have some positive signs that they're getting back to its normal function. If you find these videos helpful, there are many ways you can support this channel. You could click the like button, leave a comment saying how this video has helped you in your studies, subscribe, and turn on the notification bell. You could share Nursing to Nurture with a classmate, family member, friend, or teacher, buy merchandise, or visit nursingtonurture.com to sign up for newsletters. Remember to never give up, and as always, thanks for watching.